I wanted to start with this photo, which represents a dissociative disorder. And more particularly, in this video, it will represent depersonalization. Now let's start with a few facts. About 2/3 of people who experience a traumatic event will show depersonalization symptoms, and 1/3 of those battling a life-threatening illness will suffer from feelings of depersonalization during their ordeal or crisis. Now I show this photo again, which represents the photo on the left of the sad figure or mask, which is somebody who feels trapped in their own body, or like they are literally not within their body. And the one to the right represents that the happy one, or the kind of smirking one, represents that feeling of loss of control and how you're really trying to get back to your homeostasis or homeostatic process, or back within a normal range of just feeling normal. Now, before we go any further in this video, we really need to get an understanding of what depersonalization is in order to understand it on a level of what the causes could potentially be, recognize if somebody is going through one of these disorders, or if they're actively in a possible psychotic state that could actually be a dissociative disorder or depersonalization. And we need to understand all of this in order to really relay it as well to what has been more on the rise, and what I've heard more from even patients or even some friends, understanding what cannabis induced depersonalization really is. Before I go any further, this is your daily dose of mental health with Adam. Please like and subscribe to the channel, and leave a comment if you know anything or have experienced a dissociative disorder or depersonalization. I'd like to hear it. So let's jump right on to it. So what is a dissociative disorder, or what is depersonalization? Essentially what it means, to sum it up, is you feel detached from yourself or your thoughts, and more particularly, you feel disconnected from your environment. Also, this is, as stated, depersonalization is essentially, it's a type of dissociative disorder. So it'd be like branching dissociative disorders above, and you have different types of them. So like depersonalization would fall under that. Real quick, also, really, and also I want to go ahead and let you know what a dissociative disorder means in general. Disruption of one of three things: awareness, consciousness, and memory. So remember, once again, depersonalization is a type of dissociative disorder, but dissociative disorders are kind of a general broad term for these more specific types of dissociative disorders. Real quick, so you might be asking as well, does that mean if I'm suffering from a dissociative disorder, or if I know somebody who could be suffering from one, does this mean that it's a psychotic disorder right here? And the answer, I'm just going to say first off, no, it is not. And the main difference is that with depersonalization or dissociative disorders, you're aware of what's going on is the big thing, and people really with dissociative disorders understand that they feel detached from their environment and understand what is not real. With psychotic disorders, they don't understand the detachment, or they can't summarize or understand that they can't distinguish what's real and what's not. So if somebody who's psychotic is having a psychotic episode, they aren't aware of what is real and what is not. That's the main difference. And antipsychotic medications are not really ever actually prescribed for dissociative disorders. They can be, but that's not a first-line treatment, which we'll get more into the treatment aspect in a little bit. So causes. Researchers do not know the exact cause or trigger of a dissociative disorder or depersonalization. However, we do have potential causes, which certain personalities or mental health disorders are the main ones. So like borderline personality disorder and just general mental health disorders. Also, what is very interesting, you have a lot higher probability of developing some depersonalization with a physical condition, which I'll go into real quick, which primarily is seizures. And also, I'll just go ahead and write right here, severe, like car accidents, actually. I know this is hard to read, but car accidents. I'm just gonna write like that. Deads. Okay, car accidents. And if you think about it, that's a brain trauma, which can lead to actually some mental trauma, physical trauma, which in general, that makes sense that developing a dissociative disorder, that you could develop a dissociative disorder if you were in a severe car wreck or trauma. Also, real quick, so for physical conditions again, primarily it is seizures and like severe car accidents are the two specifics, but there are some stress and trauma examples as well, which if you think about it, abuse, family history of severe mental health disorder is big. So if you have a family history of severe mental health disorders, coming from a low socioeconomic background as well is a big one. I didn't write it on here, which can trigger as well and cause, if you're coming from a lower socioeconomic class, you can, for example, seeing your parents struggle, seeing those around you struggle and suffer can actually put you at a higher risk for in particular depersonalization. Also, as I already said, accidents, head trauma, huge. Car wrecks are the number one, which I already said, and also sudden death of a loved one, and violence. And what I mean by violence is you're seeing things. So there's a lot of these intertwining potential triggers or causes of it, which would make sense, like going through trauma, family history, being in a car wreck, having seizures. That all makes sense. But what we're going to talk about now is some of the treatments that they have right now for depersonalization or derealization. And the main thing I want you to get from it is, which will lead into the last topic, is there are transient depersonalization or derealization attacks. So if you ever develop it, a lot of times it's not like you're just going to be in that state all the time. You can go in and out of it, and sometimes, like, which we'll talk about with cannabis in particular, while you're stoned, you can have a dissociative episode, or it can last years after it, which we'll be talking about as well. But let's go ahead and jump right into the treatments. So what are some treatments for depersonalization disorder? First, the goal of treatment is to address the stressors that trigger the symptoms. So typically your healthcare provider plans your treatment based on one of the three things or multiple: general health, triggers, and symptom severity, which then follows outside of that with a treatment plan. So typically the treatment is always, number one would be psychotherapy, which is talk therapy. Talk therapy is the main treatment for dissociative disorder. So psychotherapy is it's talk therapy. So some sub-branches of this would be that specifically for psychotherapy would be cognitive behavioral therapy, or CBT, which focuses on really changing your thinking patterns and also your feelings and behaviors that aren't serving you. So you're wanting to eliminate those stressors. Also, another treatment or psychotherapy that is used is DBT, which is dialectic behavior therapy, which DBT may help with, in particular, with the severe personality disturbances. It also can help you tolerate emotions better. That's the primary objective, is being able to tolerate those emotions you're going through, those stressful environments, some of the triggers, which also would include the dissociative symptoms. DBT is useful if you've experienced, also a big one is abuse or trauma. Also, family therapy can be used, which is where you'd be working together with your family. Your family would learn more about the disorder, and also the group learns how to recognize the signs of a reoccurrence, or how to kind of tell if that could be going on within the loved one,
if they're going through some sort of dissociation. And also creative therapies, so art or music, which music in general is great for, in particular, depersonalization disorder, but dissociative disorders in general. Art or music can help you explore really and express your thoughts and feelings in a safe, creative environment, which I'll follow that up with. This isn't a type of therapy, but also exercise is really big. Exercise can help relax your brain and actually calm a lot of those emotions when you're in a heightened emotion state. Other treatments would be meditation, exercise, and the main one would be, and with meditation, it's really to help you relax. So mindfulness may help you tolerate symptoms. You can learn, for example, to tune in your own thoughts and feelings, which can be very, very helpful. So if you learn how to even meditate, learning how to tune in your thoughts and feelings, you can really, whatever you're going through, you can really key in and think in those stressful situations. Why am I feeling this way? How can I get this feeling I'm going through, whether it's racing thoughts, anxiety? How can I come back into that homeostasis level, which is just feeling normal. So really what I would say is another objective of meditation would be it can really help you just settle your body's responses, which again, just relaxing. Now lastly, real quick, medications are used as well. However, as I said, antipsychotics are not used because the person going through in depersonalization or dissociative, or if they have a dissociative disorder, a lot of times they know that they don't feel within their body, or something, they feel off, or they're not in tune with their surroundings. They feel like, once again, they're two separate people. Now, there are exceptions, though, where antipsychotics can be prescribed, because some people, like Zyprexa, can really help with anxiety, so it's being prescribed that way. But typically, you would not just be prescribed an antipsychotic right away. However, I'm not saying you wouldn't be. It's just, it's typically lower on the totem pole, and depending on the case, and in particular what I'm going to be talking about with cannabis induced, it wouldn't be prescribed right away. But there, a lot of times some of the underlying factors of depersonalization, though, you got to understand, a lot of times people suffer from depression or anxiety. So a lot of times they are prescribed an antidepressant or an anti-anxiety medication. You typically wouldn't jump to a benzo right away. However, depending on the case, they would probably actually prescribe you a benzo. You'd probably be given a benzo before you'd be given an antipsychotic. Antipsychotics, once again, can be given, but they're not given as a first-line medication treatment typically. Also, how can I prevent depersonalization disorder? So, I'm just going to be real honest. It may not be possible for you to prevent this, but it's helpful to recognize the symptoms so you can get treatment. And I've discussed that, but it's very important if you can understand those symptoms, or your loved ones can. Also, if you have experienced a traumatic event, always seek help. Always seek help. Because quick intervention can reduce the risk of developing dissociative disorders. So trauma is huge with developing these. So, real quick, can it be cured? It can't be cured, but complete recovery is possible sometimes. In some people, the disorder disappears on its own. Others, the recovery can be by going to therapy, talk therapy, you name it. And also, real quick, the outlook of people with this disorder is very good. The symptoms associated with depersonalization often do go away. They may resolve on their own or after the treatment, but you can have sometimes, which we'll go into, transient spells of it, which that's kind of the summary of just what it is and the treatments with it. Now what we'll be jumping into now is what's on the rise, which is cannabis-induced depersonalization, which I'm going to actually give a little story, or not a story, but someone who's actually talked about feeling like they've had a dissociative disorder or depersonalization. But what you really need to recognize in particular with hallucinogenics, or what I'll be talking about, cannabis-induced depersonalization and why you need to know more about this. So you might be wondering now why that I have Post Malone in the video or in the title. The reason being is because he recently came out with talking about why he can't smoke marijuana anymore. He even says he thinks he suffers from something called depersonalization or derealization, which, in all honesty, if you think about it, the way he talks about it, it makes complete sense. What is marijuana depersonalization? It is a disorder that separates people from reality and takes them to a world of unreality. Affected people may start to feel like they've gone crazy. They may begin to feel that everything around them is not real. And real quick, one big key takeaway I wanted to say is cannabis-induced depersonalization / derealization is a disorder that is characterized by persistent or recurring episodes of depersonalization or derealization. So you smoke marijuana and hallucinogenics typically, but marijuana as well, and you feel an out-of-body experience. You feel like you're crazy. You recognize that you think you're crazy, which means obviously it's not a psychotic. You're not psychotic, or it's not psychosis. But also cannabis-induced depersonalization / derealization disorder is distinguished from psychotic disorders by the presence. So let me say that again. Cannabis-induced depersonalization disorder is distinguished from psychotic disorders by the presence, meaning you know what's going on around you. If it's depersonalization, you recognize something's off. If you were psychotic or it was psychosis, you wouldn't be able to differentiate between what is normal and what is not normal, or what is regular or what is irregular. Now, real quick, so I found that interesting. So that's why I wanted to relate this to marijuana and depersonalization, because Post Malone suffers from that, which I think is very, very interesting. And that's why to this day he doesn't smoke weed. But also, what are some of the symptoms? Once again, disconnection from self-identity, feeling like an outside viewer of yourself, hopelessness, anxiety, and, the main ones I discussed a little earlier. And also overcoming marijuana depersonalization. One thing, although it can be incapacitating, one can manage brief episodes by themselves through various self-care therapies. Now, this is what I want you to really take in. In case you have an intense attack of depersonalizations when smoking weed, here are some of the best things you can do from a vast majority of sources I've read about. Here they are. So listen to your favorite music if you're going through this, cannabis-induced depersonalization. Read a book aloud, because when you read out loud or even speak out loud, it will help take your mind off of what's going inside internally. It will help change those triggers in your brain. Obviously, avoid marijuana and other drugs. And what I mean by other drugs is please avoid hallucinogenics. If you suffer from depersonalization, or let's say you have a brief episode, you try it again, it's gone. Okay, that's one thing. But let's say you do it and you keep having these bouts. That should be your sign to be like, hey, I need to stop doing this. Honestly, the big thing is many marijuana users battling depersonalization think that taking an extra dose of weed unwinds and relieves the unpleasant feelings. However, after all, at one time, a majority of depersonalization patients would have used weed to successfully relieve anxiety and depression. So if you're not going through depersonalization, for example, if you're not going through that, you would have a relief in anxiety and depression. You feel relaxed. If it's depersonalization, you're going to be anxious the whole time. Also, spend free time on hobbies and other tasks. That's a huge thing. Depersonalization gets worse when an affected person is idle or stagnant. Therefore, in my opinion, one should occupy their free time working out. That's why you see, I work out a lot in general. Exercise is very good for your mind. It's nice for the physical benefits, but for me personally, I really enjoy the mental benefits from it. Also, additionally, the patients can pass their free time gardening as well, or doing any other hobby or activity they enjoy. And you might be saying, why are you saying gardening? You know, I didn't even realize this until a couple of years ago. Like, interests change, and once I became clean myself, I found new hobbies, for example. Like, I like to be, like, during some of my addiction, I really like to, how do I say this? Kind of stay inside. I didn't like being outside a lot. And once I got through my problems, I'll just be real honest with you. I love fishing. I love hunting. I love everything out. I love doing anything outside. So the big thing is with the dissociations, which I've never had dissociations or depersonalization, but I'm saying, because I can relate to this in regards to really, you think you like one thing and then you try other things, how good that is, and that neuroplasticity works for your brain. Also, if you're going through depersonalization with THC use, avoid thoughts of going crazy. And I know that's easier said than done, because I know if you've ever smoked weed and been really high in general, even without this going on, the depersonalization, a lot of times you think you're going crazy. You think this, you think that. You're not. You're going to be okay. Trust me. Also, professional treatment for depersonalization is there if you need it. Recurrent episodes of depersonalization affecting people addicted to marijuana are best managed by therapists through therapy. And this is because depersonalized people hardly resume normalcy with self-help. That is very true. And cognitive behavior therapy, as I've talked about earlier, is amazing. Amazing for you to help improve your problem solving and identifying the fixed distortions of your thinking. And lastly, we talked about meditation therapy and medication, but these are some of the treatments if you are going through cannabis induced depersonalization. I wanted to give a real quick sum up of what it is, but now relate it to it. And from what I found between cannabis depersonalization, in my opinion, and just depersonalization or dissociative disorders in general, there are a lot of similarities, but I will say the big thing with cannabis induced is you can have an episode and go back to normal, and it's your choice if you're going to partake in it again. So my big thing is if it is cannabis, if it is a cannabis problem, you should quit smoking cannabis. You should. And that's why I respect Post Malone, actually. He doesn't smoke weed anymore. He does not do it because of that. And he even says it, sometimes he still feels like he's out of his body. So take it as it is. Real quick, please like and subscribe. This is the end of this video, cannabis induced. It's really just cannabis and depersonalization, and then just kind of what depersonalization was about. But I love you all. Thank you for watching my content. Thank you for subscribing. I will get back to every comment as fast as I can. It's sometimes hard to when you're working a full-time job as well as a psych RN, but I will get back to you, and I do care about all of you, seriously. Heart. See? Well, kind of a heart. Little baby heart. But I do care about all of you, seriously. Leave me a comment. I'll get back to you as soon as I can. This is all about just helping others and spreading just hope. Hope to anyone out there who suffers from mental health problems. Don't be afraid to tell your friends about it. Honestly, I don't do much promoting of my channel. I'll be real honest, I don't. But if you got something out of it, share it with somebody. Seriously, just share it, because I have so many different topics, and we're going to continue to pump out more videos. The next video, I will tell you right now, I'm kind of babbling at this point, but it is what it is. The next video, I will be going over, well, there's two. The first one's going to be over herbal supplements that helped me in my addiction, my drug addiction, and that can help really with any sort of drug addiction or addictions you're currently going through, these herbal remedies. So that's going to be my next video. And then I'm also currently working as well on what it is like as a psych RN to work on a substance abuse unit now. Check out my other one about what it's like to work on a high acuity unit. I'll put it down here at the very end of the video. You can check it out. But hey, I love you all. Leave a comment. Tell anyone you want about it. Yeah, just like and subscribe and hit that notification bell. Once again, peace out, guys. I love you. I hope you enjoyed the video.